Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP, tapos siyempre mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So, hindi niya na nararamdaman na minatapakan pala siya. So, probably, yun siguro yung nangyari. Minatapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos, tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After ng 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titinan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung, syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa, malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, itry ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. Ay, Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
I'm Sheila, and welcome to another enlightening episode of Simply Nature webinar. This program is brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. Just to recap on our last week's topic, last episode we discussed trigger, cancer, health, death. Interesting questions were raised and during the AMA session, and most importantly, answered by our experts. At this point, I just want to thank our dear avid viewers who joined our relatively new program yesterday, the SNA or Simply Nature Answers. This program is created to answer your questions related to PPARS. And this week, discover how cancer patients can benefit from using PPARS because tonight's interesting topic is entitled Cancer Detection, the Right Approach. Tonight, we'll explore the role of dietary patterns in supporting cancer patients, focusing on how specific nutrients and dietary choices can positively impact treatment adherence and recovery. Additionally, we'll discuss PPARS and their emerging role in potentially improving patients' chances of successfully completing their cancer treatment. Please stay tuned until the end of the program as we will be announcing the exciting promos that we are running for the whole month of December, all for the love of our Simply Nature patients and clients, as we intend everybody to be healthy this holiday season. We extend our sincere gratitude to each and every one of you for tuning into this webinar, and we encourage you to share this online event to your friends and loved ones who may benefit from the insights shared here tonight. So without further ado, let's dive right in. Please note that we will be having an AMA or Ask Me Anything portion later, so feel free to drop your questions on the comment section. Leading our discussions tonight are distinguished health experts. First, I'd like to introduce a successful entrepreneur. He's an international speaker on a wide range of topics from personal success to healthcare. He is also the CEO and founding director of Simply Nature International and the PPARS expert from Singapore, Mr. Shyan Lim. Good evening, Sir Shyan.
Hey, good evening, Sheila. Good evening to everybody. Tonight, we're going to have an interesting episode. And yesterday, we had our Simply Nature Ask. So to all the viewers of Simply Heal, right, if you want to find out more about PPARS and ask specifically about how to use PPARS for cancer, Simply Nature Answers on Wednesday is the right place to do so because we will answer specifically on our products. But you can also ask that tonight, okay? So tonight is going to be an interesting discussion. It's going to be about 20 minutes long. So I will be back at 7:50, around 7:50, 7:55 for the Ask Me Anything segment. Please feel free to ask any questions you may have about health. It doesn't have to be about Simply Nature PPARS at all. It could be from any question, actually. So look forward to the Ask Me Anything segment right after the video at around 7:50 p.m. So I'll hand the time back to Sheila, who will then introduce our speaker for tonight. See you guys later in the Ask Me Anything segment.
Thank you, Sir Shyan. Now, on to our next health expert. It's an honor to present our esteemed speaker, Dr. Jansen Calalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Calalan is a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center, Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Please join me in welcoming Dr. Jansen Calalan. Let's all watch this.
Why do doctors request for these scans? So, number one is, of course, for us to know the size and the location of the tumor. And another one, if it's going to influence our management of your case.
Hello everybody, welcome to another episode of Simply Heal. And today we have our Dr. Jansen with us.
Hi, glad to be here again.
Doc, I have very good questions for you that I think our viewers are very interested in, which is diagnostic CT scans, MRI scans, and these. Today we would like you to enlighten us, okay, for cancer walk into the hospital, right? Guys, I mean, our viewers out there, you know, it's like, do we really need these scans? Is the hospital just billing? Do I really need to share with us and enlighten us What are the scans for? Are they really necessary at all?
Yeah, okay. So we have right now the imaging tools that we have right now for CT scan, MRI, PET scan, and the nuclear imaging tools. Okay, so we have a lot of those nuclear imaging tools. Okay, so we have a lot of those that we use. So each functions differently, but the basic principle that we use. So each functions differently, but the basic principle is almost the same. It's to take a look inside your body so that we know the size of the tumor and the location of the tumor. Okay? So, let's go to the size of the tumor and the location of the tumor. Okay? So, let's go to the basic stuff first. Ultrasound.
Ultrasound.
Okay. So, ultrasound acts like a sort of a sonar. Okay? So, in order to locate the size of the tumor.
Is it expensive, ultrasound?
No. Ultrasound is not really super expensive.
Ultrasound?
No. Ultrasound is not really super expensive. It's easy inside the ultrasound if we are looking at a tumor. It's easy inside the ultrasound if we are looking at a tumor. If the tumor is if the mass is solid or liquid inside.
Oh.
If the mass is solid, then it comes out as a hyper-echoic, a gray. If it returns as a black circle.
So what
on
is
the
good?
ultrasound.
Gray.
Okay, you want it to be black because
want it
black,
to-
if it is solid or echoic, then that is for sure if it's malignant or not. Echoic, then that is for sure if it's malignant or not. Then we have to take we have to do a biopsy.
All right.
Okay.
What's the next diagnostic?
Okay.
X-rays, right?
So, okay, X-rays are light, no? It's an electromagnetic wave. Light, no? It's an electromagnetic wave. Okay, so these X-rays are in that film you will see if the X-ray passed through a solid object, or if it attenuates, it is greater, then it is usually it is greater, then it is usually on the film.
Okay.
So these structures include bones, blood vessels. Okay, so those are
tumor, what is
blood vessels. Okay, so those are
tumor, what is good, what is
or using an X-ray. What is bad is solid white. Okay? A character for a bad prognosis.
So black is good again.
Yeah. Why is black good? Because black is usually either water. Or air. Either water or air. Okay?
Wow.
Because air and water does not. Okay?
Wow.
Because air and water does not inhibit X-ray too much. Okay, so CT scans have X-ray too much. Okay, so CT scans have a higher accuracy than X-rays.
Okay.
And the good thing for remodeling, so you know where the tumor is located exactly, and you can do some measurements. Scans.
It's a CT scan, right?
Yeah, usually, but it depends on where the tumor is actually. It depends on where the tumor is actually. Okay, so for brain tumors, or if your doctor is suspecting a brain tumor, usually an MRI makes more sense. Brain tumor, usually an MRI makes more sense.
MRI. So how much is a CT scan first?
A CT scan costs around.
So how much is a CT scan first?
A CT scan costs around 25,000 to 40,000.
25,000 to 40,000. Okay,
Yeah.
I know what you guys are feeling out there now. Important question, all right? Which I know. What you're asking is, Doc, do I really need the CT? What you're asking is, Doc, do I really need the CT scan because it's 40,000 pesos? Finish with the other. What is MRI?
Okay, so MRI uses magnets.
Okay.
Basically how it uses magnets.
Okay.
Basically how it works is that it aligns your water molecules together so that it produces a sensible picture.
Wow,
of,
that's
tech.
that's more science than I understand already.
Now, the difference between CT scan and MRI is that MRI produces a much more body. And unlike CT scan, because CT scan is CT scan to the radiation. But in MRI, you don't it does.
Wow.
So an MRI is since it produces a more accurate picture.
So MRI scan is always
Produces a more accurate picture.
So MRI scan is always better than a CT scan?
Not always. It depends on what you are looking at.
Okay.
Yeah.
So how much?
Yeah.
So how much is the MRI?
It's much more expensive to the CT scan, but it's fairly close. It costs you around 30,000 to 40,000, depending on how big is you around 30,000 to 40,000, depending on how big is the scanned area. Okay.
Okay.
So the scanned area. Okay.
Okay.
So
we have we've gone through the first 4 already. Next is, what is contrast image?
Contrast imaging is basically the medical staff injecting a dye inside your body, so that this dye, when it goes to the tumor, it lights up like a bulb. Okay, so the principle behind this is that the principle behind this is that every malignant tumor has its own blood supply, right? From our previous show, we talked about it. Yeah, if you missed it,
watch on YouTube.
Yeah,
we have it
right.
on YouTube.
Okay, so basically, a tumor has its own blood supply. A malignant tumor has its own blood. A tumor has its own blood supply. A malignant tumor has its own blood supply, so that when the dye is injected into you, that dye goes into the tumor. So that once they scan it, it shows up on the scan. So that's when they know, hey, shows up on the scan. So that's when they know, hey, we are looking possibly a malignant tumor.
So how much is a contrast imaging?
Okay, a contrast imaging is significantly much more expensive than the plain CT scan or the plain MRI. Okay, so it can cost you around 40 to 50,000.
40 to 50,000.
Depends you around 40 to 50,000.
40 to 50,000.
Depending again on what institution you had.
And we're just gonna go higher.
What institution you had.
And we're just gonna go higher and higher.
Yeah.
Again, there's something we keep hearing. If you're a cancer patient, your doctor will ask you to go for a PET scan.
Hi guys. Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below, and we're going to answer them later in the live Q&A. Okay, so a PET scan is a positron emission tomography scan.
Now you know what it stands for.
Okay.
All right.
If you do not know what a positron emission tomography, just Google it. So a positron is basically, and that is the principle behind a PET scan. And we uses glucose. Remember, from our previous videos, we took a look. Here is when we take advantage of that phenomenon. So we know cancer cells are highly metabolic. So if they are highly
take a lot of sugar.
Yeah, your areas of the body
Take a lot of sugar.
Yeah, your areas of the body which are high in metabolism light up. Okay? Just a PET scan. In our body, our brain, our liver are really highly metabolic. Our kidneys, that is where even your urinary bladder. Okay, so in order for a PET scan to make sense, with a CT scan.
Also, you have to do both a PET scan and a CT scan to compare.
Yeah, so what you can find in the hospitals and the clinics nowadays is a combination of both. It's a PET CT scan. So why do we need to combine PET scan and CT scan? So the CT scan tells us the space, the anatomy
Okay.
where the tumor is located and what the size of the tumor is. A PET scan tells us its function or the physiology. So if that tumor is highly metabolic, then it probably is cancer.
Cancer.
Yeah. If it does not light up on a PET scan, then it is not metabolic. So it's probably a benign tumor.
So if you've done a PET scan already, then you will know whether your tumor is benign or a cancer tumor. So the next time you want to check the size of the tumor, you don't have to do a PET scan anymore. Just a CT scan.
Just a CT scan.
Oh wow. Okay.
Okay. So another use. So doctors use PET CT scan in what? Of course, it's going to be very expensive. So
How much is a PET CT
a
scan?
PET CT scan nowadays costs around 70,000 to 80,000.
70,000 to 80,000.
Yeah.
Wow.
So that is the range. Okay, so we know that it's really very expensive. So doctors only use it if we are suspecting metastasis and we want to locate where the
Okay, all right.
Yeah.
And last but not least is nuclear imaging.
Okay, so nuclear imaging, there are a lot of nuclear imaging modalities that we have, but I'm not going to go into one by one because there are a lot. So nuclear imaging basically is the medical team gives you a radioactive drink. You drink it.
You drink it,
Yeah.
like the Hulk.
Yeah.
You drink some radioactive stuff.
Yeah,
in
but
your
you won't get some mutations. Okay, so
Okay.
it's entirely safe.
Alright.
The amount of radiation that they give you is really very low. It's really very low. Okay, so when you drink it, that specific radionuclide attaches to the tumor or to the organ that we are trying to monitor. Okay, so once that lights up in the scan, then we know that hey, this is probably a metastasis or cancer.
So how much is a nuclear imaging?
Nuclear imaging costs cheaper.
Okay.
It can cost you around 15 to 20,000. It may actually, depending on the radionuclide they used, it can jack up to 30,000.
Wow. Okay, Doc, let's go to the really important questions that I think our viewers will want to know is, number one, Doc, do I really need to go for a scan? If I do have enough money, is it good to go for a scan?
Okay, so before I answer that question,
Okay.
why do doctors request for these scans? Okay, so number one is, of course, for us to know the size and the location of the tumor. And another one, if it's going to influence our management of your case. Okay, is it going to, once I have this scan, is it going to influence my management? Once I have this scan, am I going to do surgery on you? If I have this scan, am I going to prescribe chemotherapy? Of course, those procedures have a lot of risk. So the scan should be justified.
So my dad is 74 years old, so he actually told us, no, if it's really cancer this time round, he just wants to go natural. I say, yeah, if it's his time, his time. So, okay, so for whatever reasons, if the patient decides, I want to go completely natural, no matter how bad my cancer is become, I have my own personal reasons why I don't want to go for surgery or chemotherapy, then in that case, are all these scans necessary?
If you want to know, if you just want to know the size, no, so then you can go for the scan. But if you want to know the question, the answer to the question, am I getting better, right? Am I responding to treatment? Well, the scan is really not necessary because. Hi guys. Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A. If you want to go all natural, then these natural therapies, go for the therapeutic dose, right? So if you're already going on a therapeutic dose, and most of the time, these natural therapies don't really have much side effect like the chemotherapies, right? Because, you only get side effects if you're taking in herbs. But for food, supplements, they don't really have really significant side effects. So the risk actually of taking these the supplements and natural food, it's really low, right? So go for if you are already on a cancer protocol with this, then it's not really necessary to do the scan anymore.
Yeah, because
Yeah.
so from what I understand today is this. We go for a CT scan so that we know how to control dosage.
Yeah.
Because chemotherapy and other and surgeries, you have to know where the tumor is. So
Yeah.
since you're not going for surgery, you don't need to know where the tumor is.
Yeah.
And since you're not going to go for chemotherapy, then you don't need to worry about the dosage. So you just want to use whatever protocol. If you're eating organic carrots, eat as much organic carrots as you can. You can actually save your money because the scan will not
change the way what you're doing now.
Right? But for an oncologist, it's different. They need to know the
yes.
the PET scan so that they know to control or change your dosage.
Yeah, if they're going to increase the dose, so they need to establish that
a reason to increase the dose.
A reason to give you chemotherapy or increase the dose, right? So if your PET scan showed a metastasis, then that's the time. But if your PET scan just showed what? An inflammation or a joint inflammation, then of course that's easily managed by a pain reliever.
Just a pain reliever.
Yeah, they're not gonna put you on a chemotherapy just on that assumption that it is a metastasis, whereas it's not, right?
So that's really good news. I think Doc, really for me, I've met so many patients, and many times even me, I wanted to advise them to go and get a scan. But every time I mention a scan, the patient's face changes. They're like, I can see sweat coming out their eyebrow, and they're just thinking to me. But then they don't tell me. But I know what they're thinking. They're like, Can I don't spend the money for the scan? And today, Doc, you really helped me a lot. So for all the patients out there, this was very helpful to me. I realize now that if you are committed to all natural, you don't actually need the scan because it's not going to change what you do. Because if you are living a healthy lifestyle, the best thing that you can do is live a healthier lifestyle.
Yeah.
Eat even more vegetables, right?
Yeah.
Drink even more good water, right? Breathe good air, be less stressed. You can do more of that. Do as much as you possibly can, right? So going for a scan won't change anything.
A thing. Yeah, it won't change what you're already doing.
Yeah, so if you have cancer that metastasize, you won't, if you're not going to do chemotherapy or surgery, there's nothing new that you just breathe more fresh air.
Yeah.
Eat even more good vegetables. So then save the money and buy your organic carrots, buy an air filter in your house.
Yeah.
Get a good trip to Baguio or Sagada where it's less stressful. You can use your money this way. And of course, for patients who are using Simply Nature protocols, you can up from powder to liquid, right? So how would you tell if you are going all natural, right? So so if your body feels, if you feel good, or you feel weaker, then that's the decision point.
Yeah, that's the decision point. But again, you feel this way. Now, the question is, if you feel this way, are you open to receiving chemo, or are you open to receiving other types of treatment? So, what does that treatment entail? So, does that treatment need some information on the status of your tumor? If it does, then you probably need the scan. Okay, so because the protocol for the different staging of cancer is different. So if it is stage 4, then we go for a palliative treatment. And it also depends on the decision of the family if you want to be more aggressive. So then we definitely need to see the scan so we can have a baseline on, hey, okay, this is what I'm working with right now. And after this treatment, I want to know if you responded to the treatment. So we have to document a before and after shot. Okay, so we know, okay, this is how much it changed. This did the treatment work? Okay, so those are the things that needs to be answered, and those
questions will be answered by the results of the scan. So, Doc, thank you very much. I think today's short but very important episode is so important, and I know for all our viewers out there, I know why it's important, because I have a dad that went through cancer as well, and we meet so many cancer patients. So every centavo counts.
Yeah, of
Every
course,
centavo
of course.
every cent counts. And I've met patients who are so discouraged because they have spent their children's university fund or because they had to go for treatment. So
Yeah.
I truly understand the worries that people have. But thank you, Dr. Jansen has given us a very clear understanding. The scans are important when you need to make an update or change to your protocol.
Yeah.
So those of us who are going for chemo, who are going for surgery, please don't save money on the scan, right? You save money on the scan, you cut the wrong place.
Yeah.
All right, you save money on the scan, you take too strong a chemotherapy, and you hurt your body. So if you're going for those protocols, please go for your scans. But for those like my dad, so that's no wonder my dad didn't go for any scan. He just like, it's okay. So he went all natural, and the good news is my dad is fine. Ultimately, we did do one more scan after some time, and it's all clear. So praise God, right? So for those who are going completely natural for whatever reason, the good news is you unless your procedure, unless you're going to do some protocol that requires more information, and your doctor will let you know. But if you're just going to follow on your protocol, and if you feel a little bit worse, okay, then it may not be necessary to go for a scan. In fact, you can then invest your funds on getting even better treatment. You can actually upgrade your protocols to use a stronger protocol that will cost more, but that's where your money can go instead of the scan.
Yeah.
But of course, if you're a cancer patient and you get pneumonia, then you need to go for
The scans, the
then
X-rays.
you need to go for X-rays and
Yeah.
things like that. All right, but that's so helpful. So today, again, if you have any other questions that you want to ask Doc, if you're after listening to his advice, you're pretty excited, well, you can consult with Doc Jansen. Just click on the link below, and please give us your feedback and comments. Okay, we'll love to, Doc Jansen would love to answer your questions and have you consult. And so thank you, everyone.
Thank you, everyone.
I'm sure that you have learned so much from that discussion. We are now in the AMA portion. Know that in this modern world filled with noise of different health opinions, trust the ones from the experts. But before we proceed to our AMA, I just first want to greet our avid viewers for tonight, starting up with Miss Jeanette Koo from Child House, Miss Helen Kamonayan from Baguio, Ethel Manaloto, and Miss Noemi Veras. We would love to know where you are all watching us from. Okay, so all right, let's not keep you waiting. I can see a lot of questions are coming in and throwing privately to us. So to answer our questions for tonight, I'd like to call on once again Mr. Shyan Lim and Dr. Jansen Tankalalan. Good evening, Doc. Good evening, Sir Shyan.
Good evening.
Hello, Sheila. Good evening.
I
Hello.
almost missed coming back live. Okay.
Wow,
Doc,
sir.
so good to see you. It's a Christmas season, really. How's the traffic?
Yeah.
Bad. I was less than a kilometer away from my home, and the traffic was really bad. It took me another 30 minutes to get home.
Wow,
I mean,
wow.
that less than a kilometer. My gosh, just imagine.
Well,
Okay, so good evening, everybody. Welcome to our second last episode this year. All right, we'll be back again next year. Next week will be our last episode. 26 will be the first time in 3-4 years that we have taken a break. All right, Doc. This show has gone without fail for 4 years. Today, what episode is today, Sheila?
it's 190th. Wow.
Wow, 190. Doc. We've done 190 episodes.
Yes.
So even wow, Doc, the average view of our program over a few days, it's like more than 1,000. So 190,000 people. Wow, that's amazing. So to everyone tonight, we're so glad to be here. Big shout out to Miss Janet, all right, from Child House. And Sheila, let's get going.
All right. So for our first question tonight, this is thrown privately by one of our viewers. Question is, can imaging alone confirm a cancer diagnosis, or is a biopsy always necessary?
Okay. We are dealing with semantics here, okay? So be careful. You need a biopsy to confirm the diagnosis. However, if the characteristics of a tumor, the clinical picture of the patient, the history of the patient, the risk factors, the physical exam, all points out to cancer, then we doctors, that would be enough already for us to diagnose a patient with cancer. Okay? However, in order for us to really know with a document, with a paper written there that it is cancer, you will need a biopsy. Okay, so be careful of this, all right? When you go to a doctor's clinic, the doctor will interview you, do a physical exam. The doctor would do some tests, blood tests, imaging studies. These things would help us know if something looks like cancer. Okay, but we don't know if it is cancer yet. So imagine this, all right? Imagine you are looking at something shaped like a duck, walking like a duck. If it is shaped like a duck, and if it is walking like a duck, then it must be a duck. Okay? However, you need a light. Actually, you need to be able to see if it is really a duck. Okay? And that light, or that flashlight, is the biopsy. However, just as this is something looking like cancer, and all the signs points towards cancer. This must be cancer. Okay, so with that alone, it is actually enough for us to diagnose a patient with cancer. No. However, again, to confirm if what is it really, then you need a biopsy. Okay, because sometimes doctors can be wrong. Okay, even if all signs points to cancer, sometimes doctors can be wrong. No, we still need a biopsy. That's why doctors request for a biopsy. Okay, in order to confirm diagnosis, because we cannot, or at least the conventional oncos would not want to give you something toxic, like chemotherapy, radiation therapy, or put you on the table, for surgery, with a wrong diagnosis. Okay, so yeah, I mean, this is defensive medicine.
I will. So I think let me guess why the viewer will be asking this question. Number one, right? Doctor says that you have cancer, and the viewer says wants to believe may not be true because I haven't had a biopsy. So is that a dangerous way of looking at things? Like, okay, I haven't done a biopsy, so it's possible that the doctor is wrong. All right, that's one. The other one is, the doctor says cancer, it's not cancer. Do I have to do biopsy to confirm that it's not cancer? Is there any risk if I do a biopsy? Let's say a benign tumor, and it could be someone who is a hypochondriac, really cannot sleep at night, still not sure. Maybe she thinks my doctor doesn't know what he's talking about. If she wants to go for a biopsy for a benign tumor, is there any downside if it's a benign tumor? If she just wants to have a peace of mind, is it even necessary? Please.
So I think that the most important thing that has to be done first is to explain to the patient why we need the biopsy in the first place. What information can we get from a biopsy, and how should we use this information? How will we use this information? Yeah, so if you are thinking, if your doctor is recommending biopsy, my take on that is you have to do it. Okay, you have to do it. Why? Because if it is cancer, then we can begin treatment immediately. Okay. For cancer, it's always important that you begin treatment as soon as possible because with cancer, time is against you. The longer that you prolong treatment, the start of treatment, then the worse off you're gonna be. Okay, and your prognosis is only gonna go down over time, especially when the cancer upstages. So meaning it goes from stage 1 to 2, or 2 to 3, or 3 to 4. Okay. The next thing about the importance of a biopsy is the treatment options. Okay, so this is how we will use the information we got from the biopsy. So like for breast cancer, so we get a biopsy to characterize breast cancer, hormone receptor positive, HER2 receptor status. Okay, this will determine what kind of treatment that will be applicable for you. Okay, for lung cancers, it's EGFR. Okay, so if you're EGFR mutation positive, then you have these drugs, no, oral medications that can be given to you as versus chemotherapy. Okay, so this is how you basically choose approach things. Now, what if you are in a situation wherein I am in a situation wherein all signs point to a benign finding. Then would it be wise for me to undergo biopsy or at least get the surgery done? Now, this is entirely under the choice of the patient already. So, if we just follow the guidelines, strictly follow the guidelines, okay? Physical exam, imaging findings all point to a benign finding, then the doctor would not touch you. The doctor would not even do a surgery, okay? Except if there are justifiable reasons. One reason is pain. If you're in pain, then probably would be wise to just remove the tumor. Number 2, cosmetic reasons. If the tumor is on your face, come on. I mean, you need to remove it, or else I mean it's gonna affect your life immensely. If the tumor is on your face, okay. If it is hidden somewhere, then probably you can prolong, all right. But also number 3, no, if it affects your quality of life one way or another. So say for example, you're vomiting repeatedly, so you have a tumor seemingly benign, but I mean, you can't eat. I mean, you're gonna die from starvation if it so happens. So you have to remove the tumor. Okay, it's going to be tricky if it's not causing any problem at all. You just feel it, but I mean, you're losing. You have sleepless nights because of it. So in that situation, I mean, it's entirely on the choice of the patient to have it looked at. There are patients who just get it out of me. So it's entirely up to you. However, I just want to put it out there, okay? There are most of the time, a benign tumor will not be malignant most of the time. However, there are situations wherein a benign tumor, all signs point to benign, but when they get a biopsy, it is malignant. Okay? During the entire course of a tumor, it starts as a very small mass. It starts out as a nodule. If you do imaging studies on these things, majority of the science is gonna point towards a benign finding. Okay, so sometimes we let's just observe. Let's just put off the surgery. Let's just observe. Okay, see how it goes. Then later on the next imaging set of monitoring tests, no, lo and behold, it is cancer. Then that's the time that they act, no. Now it's really very tricky in situations like this because you're never gonna know unless it happens already. Okay, so um, entirely up to you. That's my take on this. Entirely up to the patient. If you want to have the tumor removed, even if it is seemingly benign, okay, entirely okay. Okay, so um, that's my answer.
Doc, I just want to say it's
Okay.
always best to coordinate with it. I just remember one of our patients who asked during the SMX if they're to go for surgery, and it's actually Doc Jimmy Catapia who actually mentioned, no, you don't have to take the surgery anymore. It's very necessary to talk to doctors like Dr. Jansen and Dr. Ms. Right? Okay. Prashant, shall we proceed, or would you like to add any?
Yeah, please carry on. Please carry on. Let's do
Okay.
others.
All right. Another question coming from a teacher from Zamboanga, Sibugay. My lump is operated and sent for biopsy. Then the results were HER2 positive with score of 3 positive. Do I need to have another operation again? What if I don't and just take herbal medicine?
Okay, if you are HER2 positive status, the breast cancer is aggressive. Okay, the breast cancer is aggressive. So, and of course, for any other types of breast cancer, the best approach is to have it removed. Um, if the tumor is not in your body, the treatments become simpler, both on the conventional side and on the integrative medicine side. Everything becomes simpler, even with the monitoring. You're gonna be spending way less as well over the long run if you have it removed. So my advice is have it removed. Now, for HER2 positive breast cancer status, trastuzumab is always recommended. Okay, because if you go on trastuzumab treatment, survival rates of HER2 positive patients, the survival rates really increase. Okay, prognosis becomes better. All right. Now, if it becomes better with trastuzumab, there are also other ways, no, other treatments that you can add onto it to even improve the overall survival. So that is where integrative medicine comes in. Okay. So now trastuzumab is a treatment. It can also be used for recurrence prevention for those patients who have had their tumors removed. Okay, so my take on this, I would go for the trastuzumab treatment as well. Now, for the integrative medicine side of things, there are a few that we can do. Number one, metabolic therapy. So eat properly. We try to starve the cancer as well. With that, number two, terrain. This means your body. So we make your body healthier. Okay, so you'll be able to tolerate the treatment better. And of course, if your body is generally healthy, I mean, it's gonna be better overall survival, regardless of the cancer diagnosis or not. Okay, and lastly, of course, is the pulse therapy, which I use high dose vitamin C. I use brain aspect of things because it makes your body healthier. It is also under the pulse therapy. So pulse therapy is wherein we give something in periodically to kill the cancer directly. Okay. Another thing that we prescribe for these kinds of patients is ivermectin and mebendazole. So these are anti-parasitic medications for cancer patients, no? Because it can stop the cell division of cancer. So that's one approach that we can go for. No? So I won't entirely say you forego conventional treatment and just focus on herbal medicine. Herbal medicine works in a few patients. The problem there is how would we know if you are one of the patients wherein herbal treatment alone would work? We don't. Okay, so it's up to you. I mean, nobody's gonna force you to undergo this treatment or that. However, if you do decide on just herbal treatment alone. You have to understand that herbal treatment does not work for everybody, and it only works for a very small amount of people. And if you have a cancer diagnosis with HER2 positive status at that, no, with which is very aggressive, then you have to weigh things, no, for yourself. If going solely herbal would be a wise decision. Yeah.
Okay. Yeah, my input is that, as Dr. Jansen says, your type of cancer is aggressive. Okay, so for anything aggressive, your treatment should also be aggressive, because the result of cancer is not weakness or anything. The end result of cancer is death, right? So if your cancer is aggressive, you've got to go for the most aggressive treatment. So right now, honestly, the most aggressive treatment will be conventional treatment. So that includes radiation therapy, chemotherapy, surgery. Again, share with you an encounter this year that I had, right? I had a long-time acquaintance, not a very close friend, but is a close friend of a friend of mine. He's a Taiwanese, so I've met him a few times. He's very hospitable. When he came to Philippines, we also meet. So it's a friend. And what I found out was that he had a growth in his liver. He had a tumor in his liver, and the doctor suspected it might be cancerous. So linked to the first question we had this evening, which is should he do a biopsy? He did a biopsy. He took a long time to decide if he wanted to do a biopsy. Then anyway, he did a biopsy because the tumor continued to grow. Then when he had the biopsy, it turned out to be malignant. So it is liver cancer. All right. And during this whole time, I had a discussion with him, give him information about PPARS, encouraged him to see his uncle. So the uncle said surgery. So he was reluctant, and he was just taking a lot of time thinking about it. A lot of time is like 2. So about 4 months later, my friend called me up and told me that, oh, this friend of ours has passed on. Oh no. What's the picture of my friend? It's terrible. Mummy, when you watch the movie, those mummies, it's literally, and then all the flesh stick to the bone. His skull was completely sunk in. And the scary thing is, this person used to be more chubby. I almost wanted to say chubby like Sheila. Okay. What I meant was like, he was chubby and became like that. So I then realized if you just hesitate, it can be like that. Sheila, nasopharyngeal, 4th stage, right? And when I saw her son Dominic, it was skin and bones. So that moved my heart straight away. Trying to share with you that don't waste too much. Your diagnosis is a very aggressive cancer. Okay, so go straight away for treatment. Don't waste time. For breast cancer, doc, am I correct? Breast cancer is like so treatable in the sense that because there's so many breast cancer patients, all the protocols for breast cancer is like very established. It's like because the doctors see so many patients, they are so used to it, they know what to do. So the encouragement for you is that don't worry about chemotherapy, immunotherapy, all that, because we have PPARS to support you. And it doesn't mean you cannot go herbal. It only means that once you slow down your cancer, make sure it's under control, the tumor is no longer growing, no more spreading, you have more time, then you can go back to explore your herbal remedies. But again, this is where I'm coming from, Doc. Okay? Right?
Yeah. I just want to echo out now what you said before in terms of the herbal. I guess this would interest those who are considering to go for herbal. And there are herbals that can contraindicate the medications given in the hospitals. But I'm very pleased to tell everyone that PPARS, on the other hand, has no contraindications and can be taken along the conventional treatment that we have. Okay. All right. Well, for our next question, Taron, by Francis, down to us privately again in the inbox. Hi, what products can you recommend to a lung cancer patient with Jhen, and what is the dosage with PPARS powder?
Yeah. The default answer is PPARS liquid. I would only because powder you take it sublingual, then just let it melt inside your mouth. So that's the only time that I would recommend powder. But if the patient can swallow, then it's always gonna be liquid, regardless of the stage. Regardless of the stage. Okay.
Yeah, and this one for because you haven't reached your staging yet. Lung cancer is another one of those cancer that can be very difficult. All right, so don't delay. Do what you can do immediately now, which is to be able to take PPARS, because PPARS you don't it's not like chemotherapy. You don't have to go for a biopsy yet. You can already do something to fight your cancer. And the good news is lung cancer is one of those specific cancers that we actually tested the liquid extract liquid, PPAR liquid that Dr. Jansen just recommended. It actually showed that for large cell lung cancer, we actually induce apoptosis. Basically, it means the cancer it's effective in the study that the cancer cells start to die. All right, so it's wonderful step that you can take. Right? In the best case scenario, it's going to start already to successfully stop the growth and reduce your lung cancer tumors. In the worst case scenario, right, in therapy, it prepares you for whatever next protocol that you're going to help you to fight your lung cancer. So there is win-win. It's really win-win. Okay. Now, to any viewer who uses Simply Nature PPAR products, when you start, right, cancer is not a 1 week, 2 week, 3 week journey. It's actually a few months of aggressive treatment and years of continual effort to make sure that it doesn't come back. All right. So please don't feel shy when you're worried about money. When you first start, I think everybody's okay. Let's do something. Let's do the best right now, right? Let's treat mom. Let's do something so we can. But as the days go by, suddenly the bills will start to add up. Okay, the bills will start to add up. You will start to think already, how am I going to sustain this and things like that. So to all those who are using the PPAR protocols or any cancer protocols that we are supporting, please talk to our healthcare specialists, talk to Ciela, talk to our CSOs, let them know if you have any financial concerns, because they can tailor a program and recommend to you the best combination that will allow you to sustain the treatment. Right? Not only is the treatment effective, it must be sustained. That means you must be able to financially keep on this treatment over a period of months for the aggressive treatment, and also after that for maintenance. So to all the viewers out there who are to know that, in our company, we really believe to be with you from your start till you achieve your healing, and that how we can also help you manage the cost. Okay, that's important. Thank you. I just wanted to say that.
We always give all the options. Of course, not only that we are considering the health conditions, but also your budget. We understand.
Yeah. So of course, also on our program, please let it is Dr. Jansen and my policy to always recommend the best. Because why would we not recommend you the best, right? You have cancer, we will definitely recommend you the best. However, sometimes finances become a a consideration. So don't be shy about it. Let us know, okay? And then we'll tailor it to best fit what you. Then we can give you the best that you can sustain, right? The best that you can sustain. But definitely, when we first recommend, we will definitely recommend you the very best, because we will not prejudge. We will not say anything. We will just aim to give you the best advice, the one that gives you the highest chances of success. Thank you.
Always, sir. Thank you, Sir Shyan. Thank you, Dr. Jansen. Next question coming from Ms. Jennifer Nang. Can PPARS liquid extract repair or cure stroke patients?
Oh, interesting. Doc, you can talk about one of my friends who actually experienced it.
Yep. Okay, the mechanism of stroke is like heart attack. Okay, so with heart attack, that got plugged, no, which led starved of oxygen, nutrients, which led to the heart muscle dying. So imagine this thing. There's the second type, a blood vessel rupturing. So it's bleed, no? Now, if the stroke has attack, okay, if it is the, however, if the stroke happened already, okay, the damage already, okay, the damage is very difficult. Should have reversed. It's very difficult. Should have reversed. The we see stroke patient fully recover, the patient would not be the same as he was before the stroke, okay, because there was brain tissue damage already. Now, what PPARS can do, no, is to lower it after the stroke. What we're talking about is after the stroke happened already, no. PPARS can help lower inflammation. It can help restore the patency of the blood vessels. So, go rehabilitation, physical therapy, occupational therapy, these things, no, recovery is faster. Okay? So yeah,
No,
yeah,
no, I mean,
go ahead. That's it. That's it. Yeah, that's
no,
it.
I just want to second everything that Dr. Jansen said. In fact, everything he said is exactly what my friend experienced, right? What happened was my friend is actually a distributor of PPARS in Singapore, okay? So of course, when he got a stroke, I'm like, huh? You're taking PPARS, how can you get a stroke, right? But his stroke is not because he's unhealthy. His stroke because he actually owns one of the largest spa chains in Singapore. So they do use PPAR in their wellness program. Now, his stroke is because there was a hostile takeover of his company. So he was very stressed. Someone was trying to buy over his company in a hostile manner. So his stroke came because of a stress. So he had like a stroke and heart attack in the car park. Actually, he's a very healthy person. So he was totally stress induced. When I happened to be in Singapore at that time, so I went to the hospital to see him. I was totally shocked, all right? His hand was like that. And then his mouth was like that. You can't talk, that is how he talk. You know, I was stunned, you know, because his was a sudden thing, right? And then he can't even move his body. So it was like, oh my God, it was like both hands, both legs, half the face. Like, so I was like, oh no. Okay, here's the amazing thing. 6 months later, he stood up. And then 1 year later, he went back to office. Yeah, so yeah, it was very inspiring, all right. But like what Dr. Jansen said, he's not the same. He still walks with a limp now. Okay. His speech is, I would say, 80% back to normal, but there's still that 20% slight slurring. Okay. His hands, instead of like that and not being able to even move at all, it's now, yeah, he can move it, but of course it's not strong, right? And he has full motion, but he can't like play tennis or anything like that, right? So, but what's amazing is that his doctor said he might not be able to walk again. So from the doctor saying you'll never be able to walk again to being able to walk with a cane and good enough to go back to office, it's a miracle. Okay, it's a miracle. It's a miracle. So he did a lot of things. Being a wellness owner of a wellness spa, so he had all the massage, all the equipment, including magnetic beds, everything. And he was drinking like 2 vials of liquid pipa every single day. And he had this incredible willpower, right? So, so that's one thing I just want to encourage that, you know, this is my experience with a particular stroke patient. And he went through, he had very strong will. He wanted to get well because he wanted to defend his company against the hostile takeover. All right. So the desire to get well is important. The next thing is during the time that he got stroke, of course, as a friend, I quickly did as much research as I can, and I found out everything that Dr. Jansen said. Actually, if we within the first 2 hours of the stroke, if you can actually drink liquid PPARS, it will actually help to mitigate the damage, because once you have stroke, the damage doesn't just occur instantaneously. It right until the condition is stabilized. So if you actually do that, if you take the PPARS very quickly, it will actually help the body minimize the damage. Might be because one of the mechanisms I suspect is controlling neural inflammation, right? The other thing is that I read is that it actually, for after the case, it, if I'm not wrong, it actually encourages like neuroplasticity. So that means it allows the brain to rewire its connections. It facilitates that a little. I'm not sure how much, but it says that it could facilitate that process. So in combination with my friend's very aggressive desire to get well, his case is really a miracle. And then later he wrote a book and he launched his book and everything. So it turned out to be quite an inspiring story. So yeah.
Yes.
So that's only doctors say there's nothing we can do, right? So why not try? Yeah, why not?
Exactly. Very much aligned to what Doc Jansen said in terms of the recovery. Thank you, Sir Shyan. Thank you, Doc Jansen. Another question coming from Ms. Lisa Bordon. Good evening, Doc Jansen. You have consulted me before at Tree of Life. You prescribe PPARS Plus, PPARS Soft Gel, and curcumin and multivitamins. I haven't taken anything. And therapy is tomorrow. Is it okay if I take all this after the chemotherapy?
It's okay. But I would advise you to take them now. It has been so long. I think I last saw you. So patients, so it doesn't only you. There are also other patients similar to you. They buy all the supplements and they don't take them. Why? You have to take them as soon as you can. No? Tonight is fine. Okay. Now the chemotherapy medications that you are that is going to be given to you is doxorubicin and cyclophosphamide.
Yes.
I'm going to backtrack a little bit, no, because there are chemotherapy medications that you can actually mix PPARS with. So, last night I attended Simply Nature's Doctors Forum.
Oh, yeah? No, you were there.
So, the how PPARS work for a patient's body and how chemotherapeutic medications work against tumors, they undergo different pathways. So there's actually, if you give them together, it won't counteract, it won't diminish the effect of each other. But here's the thing, no, I think it was cisplatin and oxaliplatin that was investigated, no, that was discussed last night. The patient is being given doxorubicin and cyclophosphamide. So my guess is it would be safe likewise to take PPARS together with the doxorubicin and cyclophosphamide. However, just to be on the safe side, no, and so that we are also fair to your onco who is handling you. Better not to take the PPARS on the same day. So take the PPARS and the curcumin, the multivitamins, 24 hours after they give you doxorubicin and cyclophosphamide. Okay, so that if for reactions, I mean, PPARS won't be blamed.
Yeah.
Yeah, but my guess is the doxorubicin and cyclophosphamide would be safe, no, if taken with PPARS on the same day. Yeah.
Same as Dong Hill. I didn't know you were there. Okay. Yeah. So one additional thing is my stance is exactly the same with Doc Jansen. In fact, I said that last night. The only time where I would say will prompt you to say, okay, you will take it like just an hour or so, or maybe a few hours before your taking your chemotherapy is if you're not reacting well to the chemotherapy. You know what I mean? That that every time after you take the chemotherapy, your condition is so bad like you need to stop your chemotherapy for the next cycle, right? Then it's better to take it together to minimize the side effects. At least you can keep to your chemotherapy cycles. You won't disrupt your cycles. So that's the only time where I would say that we sort of don't give your onco the space if you are reacting very badly to the chemo. Okay? Then if that's the case, then strengthen yourself as much as possible during your chemo so that you don't affect your cycles. Because if you affect your cycles, the timing and schedule, remember, cancer is always also a fight against time. So you want to be able to keep on your schedule better than you drop off your schedule, and things could complicate because you didn't your schedule is delayed. All right. So is that fair, doc? I mean, that if the patient is like so terrible, then so terrible that she's afraid to go for the next session, then better to take it together so that at least
Yeah.
she can take it, right? Yeah.
Yes,
That's
yes. I would also advise the same.
Yeah, that's the only time. If not, take it separately so that it's fair. Like what Dr. Jansen said, it's fair for your onco as well.
Thank you, Dr. Jansen. Thank you, Sir Sean. Next question coming from Ms. Jhen Ang. Is pneumonia a risk factor of lung cancer? Thank you.
No. No. Pneumonia is a syndrome. It's an amalgam or a combination of different signs and symptoms with chest X-ray findings, abnormal CBC counts. Okay, so that's how that is what pneumonia is. Okay, it's a combination of different signs and symptoms. Okay, so usually with fever, cough, colds, some pneumonia patients do have colds. Then when we listen to your lungs, there are abnormal breath sounds. So you have crackles or whatever, decreased breath sounds. Then on imaging finding, you have abnormal X-ray finding. Then on CBC, it's also abnormal. That's how we diagnose pneumonia. Okay, that's how we diagnose pneumonia. So if you have these symptoms, anything, there are a lot of things that can cause pneumonia. So it can be infectious, it can be pollutants, it can be an underlying condition like lung cancer or pulmonary edema, heart failure, these things, no? So pneumonia is a condition. So if you have pneumonia, it doesn't necessarily lead to lung cancer. Okay, there are other reasons that leads to lung cancer. Say, for example, chronic smoking. Yeah, chronic smoking can lead to lung cancer, but chronic smoking does not necessarily mean that you will get pneumonia, although it also predisposes you to get pneumonia.
Mm.
Okay, so I hope I explained it. I hope I explained it well, no? So pneumonia is not a risk factor for lung cancer. It does not cause lung cancer. It will not lead to lung cancer. Okay, because pneumonia is it's an entirely different entity in and of itself. Although lung cancer patients can develop pneumonia. Okay,
Yes,
lung cancer patients can develop pneumonia.
Doc, I wanted to say this. I've had quite a few clients and patients, cancer patients, who died from pneumonia. That means they are, and usually they have gone through quite a lot of treatment already. So they are on chemotherapy, quite a few cycles, and then almost all of them were actually doing well. It's like things were going well. Then they caught a flu. Then it developed into pneumonia, and they actually died from the pneumonia. Do you have any comments about this? Is this something very common in your experience as well? And how do patients protect themselves from developing pneumonia in general, especially if you're a cancer patient and living in the Philippines during typhoon season and all that,
The reason why cancer patients die, is almost always a complication of some sorts. One such complication is pneumonia. Now, how does a cancer patient die from pneumonia? Number one, if the cancer patient have been treated again and again, and they are in immunosuppressed state. Okay, so their immune system is so bad because of repeated treatment, chemotherapy, and it's very easy for them to acquire an infection. And that simple infection, a flu probably, the flu, a simple virus, can wreak havoc in their lungs, and lead to pneumonia, and they die from pneumonia. Okay, um, this is one of the situations that we are trying to prevent here. So that's why we are always saying that if you're a cancer patient undergoing chemotherapy, you need chemotherapy because chemotherapy would kill the cancer cells, but you have to protect your body as well. So you cannot go out into the battle naked. Okay, you have to have some armor, some sort of armor. That's why Simply Nature PPARS exists, is because of this. There are also other products, other companies that has these properties, no. But so far with my experience with Simply Nature PPARS, it's they have better results compared to their counterparts. That's why I stick to them. Okay, and with sometimes they tried a lot of different things. Then they encounter Simply Nature PPARS. They stick to Simply Nature PPARS. For some reason, they get off of Simply Nature PPARS, then try different things again. Then they resort back to Simply PPARS again. So there are patients who are like this, no. So yeah, I think in this sense, product really works, no. Not just in the scientific sense, but also clinically, so patient experience wise, no. So yeah, so I just want to say chemotherapy support is really very important. Okay, so if you are someone who, I mean, who's strong enough, go for chemotherapy without any other things, then good for you if you are quite successful. But I should say that there are also quite a number of cancer patients who really cannot tolerate chemotherapy, and they have all sorts of bad reactions, and they just cannot continue, and they just stay away from the onco. So here's an
Yeah.
opportunity for you. Okay, yeah.
And if you stay away from the onco, it could be quite sayang because this is what happened also. This is a personal friend, actually, Doc Jansen's patient, because I referred her. Yeah, right, Doc, the one with the breast cancer. She stayed away from oncos, and that's when the cancer metastasized and got really complicated. And by the time she went back to the oncos, what happened? It was very difficult, but she did well. She did well. And then after that, she was not careful. I think she, if I'm not wrong, was it pneumonia too? Or she caught it was something else that weakened her, and then the cancer got another foothold. So the moral of the story is this. I know, okay, this part, Doc, I will interject. I know many uncles will say this. Not all, but many uncles still say this. Just go for the chemo, don't take anything else. All right. That actually, in my personal opinion, is incomplete advice, right? Because in many hospitals now, the treatment of cancer is now, they prefer to do it with a cancer team, right? Not just the onco, but also a nephrologist or whatever, and nutritional support as well. So it cannot just be do your chemo and immunotherapy. There must be something more to support the entire process through cancer. All right, so that's where we are. And the good news is, over the last few years, we've been making more and more inroads. As Dr. Jansen said yesterday, it was a talk with other oncologists, and actually very prominent oncologists. So I'm looking forward in 2025 to meeting even more of them and to hear their feedback. One last one. This is actually straight from the mouth of one of the very first pediatric oncologist in Philippines. So now she's a senior, right, with gray hair already. All right, and then she was just sharing because she was the one that assembled the other pediatric oncologists, her juniors that she's mentoring. So they had a case of a boy, young boy from a humble family, right? And the boy was not reacting well to the chemotherapy. Everything they tried, just not reacting well. So very problematic because they had problems to continue the chemotherapy. So out of desperation, this particular pediatric oncologist told her junior, try this. And it was miraculous. The boy just got well, got strong, and could continue with the chemo. And the doctors were concerned because the boy was on liquid extract, right? And they come from a very humble family. So really, financially, it was expensive for them. So the doctor actually was asking them if they wanted to try the powder extract because it's 3 to 4 times cheaper, right? But to the doctor's surprise, the family wanted to continue with the liquid. So this is again back to the reason why me and Dr. Jansen will always recommend the best for you, and then after that work with you if finances is a limitation. All right, but we will always recommend the best. And yeah, cancer support so important. Sheila.
Very important. Thank you, Sir Shyan. Thank you, Dr. Jansen. Next question, coming from NoRVYL. I have bone cancer almost 5 years ago, and I'm also teaching in public school. My right leg has been amputated. My hip also had the hip disarticulation. Now, what do you think would you recommend for me? Case is actually bone cancer osteosarcoma.
Wow. I want to congratulate you first, no, because you're still here with us, no, despite getting a bone cancer diagnosis, no. Yeah, for bone cancer surgery is really the mainstay. Okay, and I think the bone cancer was detected early, and the surgery was done quite early in the disease, no, which is why you're still here with us. So right now, I should say that I think you're out of the woods because if you can teach and you have this history, I think you're strong enough. Now, what I would do is just to monitor. Okay, monitor maybe once a year, no, just to see if there are any recurrence. If you are really, if you are in a situation where you can do more tests than once every 6 months. Okay, so just monitor to see if there are any recurrences, no, for this. Chances are it won't recur. Yeah, chances are it won't. So I think you're out of the woods, but yeah, monitoring is still a must. Okay. Now for if you're asking for supplements, okay, you can take supplements that can make you stronger. I mean, for general health. Okay, so you can take those supplements, especially if you are a teacher teaching in a public school. No, you're gonna be standing all day. Difficulty of with standing because you have one leg left. No, but all the more, no, because of course you would be writing all day. You'd still need to do your lesson plans. No, yeah, the demand of of public school teachers is really quite high. So yeah, a few supplements that can make you stronger, like vitamin D3, some multivitamins. No, you can just choose whatever is available. Simply Nature PPARS, you can this, no, and see how if it gives you more energy, how your body responds to fatigue. Okay? So yeah, that's what I would do right now.
Thank you, Doc. Thank you. I guess this will be our last question for tonight. Coming from Ms. Janicio Roberto, is it curable if cancer is stage 1C?
Only if you have it removed. Surgery, okay? Only if you have it removed, and of course have the sample analyzed, see what kind of cancer it is, if it is aggressive or not. No, then do the necessary adjunct treatments, then I should say that, yeah, it is curable. However, it still depends on what kind of cancer it is. Yeah. Okay.
Shyan?
I just want to, yeah, because Doc Jansen said a magical word. He didn't say treatable, he said curable. Yeah, it's very, very strong, positive steps. All right, very, very clear steps. So don't hold back. Stage one, to be able to detect cancer at stage one is a blessing, because normally people catch cancer in the later stages. That's why it's often when you hear that person gets cancer, it's not a good news, because usually it's already stage 2, 3, or high, even higher. All right. But I have one last thing I hope we can answer, because April asked a question which I think needs. April says she has metastatic lymph nodes in her tummy. So the doctor says that she needs to undergo chemotherapy. What is your general opinion on a situation like this?
Yeah, if you have abdomen that got metastasis, it's a bad situation. That's why the oncos are recommending systemic treatment. My take on it is, yeah, you have to undergo the chemotherapy, but don't forget your immune system. You have to take the necessary supplements, the necessary diet, the steps to support your body through the chemotherapy. Now, the amount of cycles, or the number of cycles for chemotherapy, is fixed. Okay, you won't be on chemotherapy forever. Okay. However, the supplementations, the things that we can give you as a supplement, things that we can give you to enhance the effect of chemotherapy, but also at the same time make sure that your body is well supported. We have those tools. Okay. The question is, would these tools be applicable for you? Now, I have to see you for that matter. But just to give you an idea what these tools are, of course, one is Simply Nature PPARS, another one is high dose vitamin C, another is ozone therapy. These are some of the tools that I use as supportive treatment, no, supportive supplements for patients like you.
Well, may I just say that for those of you who wish to have a consult with Doc Jansen Kalalan, you can just type in how to consult, or the link to schedule a consult is in the description box. All right. Well, at this point, once again, I just want to remind you, this is our 190th episode. This is our second to the last episode for this year. Okay. And I just want to ask for your very encouraging, quick parting words before we end our day today. Shall we start with Doc Jansen?
Okay, yeah. So this is the second to the last episode for the year. Am I right? Yeah.
Yes.
So next week I won't be able to appear for the Q&A because I'm going to on a vacation with my wife and her side of the family. So Merry Christmas to all of you, advance Merry Christmas, and I hope these webinars that we've done every single week have helped you, throughout your journey as cancer patients. This is a year, 2024. I believe 2024 is really a good year. Even though, for cancer patients, you get this diagnosis, you have this situation. There's always some hope, no? With the treatments that we're doing, and with all these knowledge, that we're sharing, I hope you learned something. Next year is gonna be another amazing year. There will be new updates for sure. There will be a lot of conferences in line that I will attend, and the learnings I will share with all of you. Okay, there will be changes. So whatever I say, at least for this part of 2024, some of them might change for 2025. Let's see if they change. But hold your stay tuned, no? Stay tuned. So always be with us every Thursday night. So you'll be updated as well. Okay. Yeah.
Thank you
So I'll
so
give the
much,
floor to Sir
Sir
Shen.
Sean.
Same as Doc Johnson, really appreciate everyone. 2025 will be also another interesting year for this program because we at Simply Nature we are engaging the oncologists aggressively next year. Right, so we are also going to dive deeper into how our product works with how it works in the fight against cancer. So this is so next year you're gonna even hear more technical how shall we say information, right? We're gonna get even clearer on how to support you, especially if you go through chemotherapy. And of course, as I interact with more oncologists, there's gonna be more insights, more patient cases, and I pray that all of that will be encouraging and useful as reference and guide in your own journey, in your own fight against cancer. So with that, I just want to wish everybody a Merry Christmas and a Happy New Year. There's always hope. Christmas is the season of the Lord, right? So just remember, at the end of the day, our lives are in the hands of God. So prayer is a very important part, and faith is also a very important part of your journey, in your cancer journey to successfully beating your cancer. So our prayers are with you. Our best wishes are with you and your family during this holiday season. All right, so I'll see you next week for our last episode of the year.
Thank you, Sir Sean. Okay, I just want to say that we are so blessed to have Mr. Shyan Lim and Doc Jansen to always answer our questions every week. And as they impart their knowledge to us, I'm very sure that a lot of our viewers are very much encouraged to continue on with their health battles and their health journeys. Thank you once again, Doc Jansen and Sir Sean. Now, at this point, a while ago, I've mentioned that I will be announcing some good news tonight, okay? Because you are in for a treat. Catch our ongoing Lazada 12/12 mega sale and check our participating products. This is the best time for you to get healthy, not only for yourself, but of course for the whole family. Another exciting news is that on top of our ongoing Lazada 12/12 mega sale, we are also offering limited time amazing discounts that you don't want to miss. Shop now at the official Simply Nature website, www.simplynature.asia, because if you spend a minimum of 6,500 up to 62,000 pesos worth of Simply Nature PPARS products, you can get an instant discount ranging from 50 pesos to as huge as 500 peso discount. That is amazing, right? And yes, the more you shop, the bigger the savings. So hurry, because this offer is only available up until the end of this December. Another promo that we are running right now, I just want to ask everybody, do you know anybody who has diabetes, hypertension, or other metabolic illnesses? I am very sure that you are thinking of that someone right now. Manage their health issues with Simply Nature PPARS soft gel capsules, because our ongoing promo is the 5 packs of soft gel capsules and get 1 pack for free. 1 pack is actually worth 3,600. That is the worth of free products that you are getting. Okay. Now, another one, yes, just wait because there's more, okay? This holiday season, give the ultimate gift of health and wellness to your loved ones, because we are thrilled to introduce our special gift packages, the Power Pack, perfect for 5 days of rejuvenation and energy, and the Kickstart, a comprehensive 15-day program to jumpstart wellness. And here's the best part. If you purchase 10 boxes, you can actually get 1 free. Guys, please message us, because we may give, all right? Simply Nature is feeling more generous this Christmas. We may give a little better, okay, than this buy 10, get 1 free. Talk to us and message us here on our Facebook page. All right, because there's no better way to show you care than by giving the tools for vibrant health and well-being. These thoughtfully designed packages are ideal for anyone looking to feel best. After all, who wouldn't want to love and give someone, their loved one, a good health, right? So don't wait for the best health, not only. Thank you so much. Now, once again, we really hope to see you again next week. That will be our last episode for this year, 2024. That's Thursday, same time, 7:30 on our regular Simply Nature webinar entitled New Cancer Patient, What's Next? Now, we will be doing on 26 or December 26. Once again, we will not be having a webinar, but please still continue to watch our ongoing webinar on the next 2025. Thank you. Okay, so thank you once again, everyone, and see you tomorrow. I'm sorry. Thank you once again. Over health battles are what keeps us going here in Simply Nature. Because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.
Come give me something I can feel. Oh, oh, oh. Don't you want me like I want you, baby? Don't you need me like I need you now? Sleep tomorrow, but tonight go crazy. All you gotta do is just meet me at the Don't you want me like I want you, baby? Need you now. Sleep tomorrow, but tonight go crazy. All you gotta do.
This holiday season, give the ultimate gift of health and wellness to your loved ones. We're thrilled to introduce our special gift packages. Power Pack, perfect for Kickstart, a comprehensive 15-day program to jumpstart wellness. Buy 10 boxes and get 1 box for free, and make this season truly special for the people who matter most.